everyone, welcome to my YouTube channel Nursing Education. Today I'm going to talk about antepartum diagnostic test, which is helpful for the nurses and for the Nclex exam. So this testing we do in the pregnant woman throughout the pregnancy. So this is called antepartum diagnostic test. So we do the blood test and RS factor. So this we do in the first visit of the woman to the antenatal clinic. We do the STI testing where we do the syphilis test, HIV, hepatitis B testing, and all those things. We do the glucose saline test during the 24 to 28 week of gestation to see whether the woman is having gestational diabetes or not. We do the urine analysis to see the infection in the urine in the woman. Then next we do the ultrasound during the 6 to 12 week to see the gestational sac, cardiac activities of the baby, and dating. Again, we do between 18 to 22 week of gestation to see the anomaly of the baby, and then again we do after 36 week of gestation to see the position amniotic fluid. We can do in between if the woman has got any complaint. Then we do the non-stress test to see the fetal well-being. Then we do the group beta streptococcus test to see the infection in the woman of group beta streptococcus, and then we do the kick on. So we'll discuss one by one in the detail. So blood type and RS factor. So this we do during the first visit to the antenatal clinic of the woman. It is very important to know the mother blood type. And if the woman is RS positive, it's okay, we don't have to do anything. If the woman is RS negative, then we have to be a bit concerned and we need to give the treatment for that. If the mother is RS negative and the baby is RS positive, that put the infant at risk for RS incompatibility. That is also called erythroblastosis fetalis. So what happened here is, if the woman is RS negative and then fetus is RS positive, when the blood of the baby goes to the mother blood, then mother blood think that is the foreign body and produce the antibodies against the baby blood, and in the subsequent pregnancy that antibodies goes to the baby blood, and that cause the RS incompatibility. So to prevent that, we need to give treatment that is called as ROGAM, RSD immunoglobulin. So we give at 28 weeks of gestation in the pregnant woman. Then within the 72 hours after delivery, if the infant is RS positive. If the RS negative is the baby, then we don't have to do anything. But if the baby is RS positive, then we need to give the ROGAM within the 72 hours after the delivery, and also following the termination of pregnancy, such as following the miscarriage. Then glucose challenge test. So the glucose challenge test is performed between the 24 to 28 weeks of gestation. So first test we do is oral glucose tolerance test. It's called OGTT. If the OGTT is positive or the woman blood glucose is higher than 140, then we do the 3-hour GCT glucose challenge test. So what we do in the oral glucose tolerance test is we give the woman 50 grams of oral glucose at any time of the day, and after 1 hour we draw the blood and check the blood glucose. So within that hour we ask the woman not to drink or eat anything, and then after 1 hour we take the blood. It is considered elevated if the blood glucose after 1 hour of having 50 grams oral glucose is 140 mg per day or 7.8 mol per liter. That is considered elevated, and we need to do further test, that is a 3-hour GCT test. So that is called glucose challenge test. So 3-hour glucose tolerance test is done in the fasting. So women should not eat or drink for 8 hours prior to this test. We ask women to drink the glucose liquid 100 grams, and then before drinking we take one fasting glucose, and after drinking 100 grams of glucose we draw the blood 3 more times every 60 minutes. So after drinking, we take 1 hour, 2 hour, and 3 hour, and we check the glucose level every hour. So, and after the 3 hour, if the blood glucose is still elevated 140, that indicate woman is having gestational diabetes. So, 3 hour glucose tolerance test abnormal result are if the fasting glucose is more than 95 mg per dl, that is considered elevated. In the 1 hour, if it is more than 180, 2 hour more than 155, and in the 3 hour, if it is more than 140, this means that woman is having gestational diabetes and we need to treat that gestational diabetes. So next test is non-stress test. So this test performed to assess the placenta function, oxygenation, and to determine the fetal well-being. So this test evaluates the fetal heart rate response to fetal movement. So this is like one graph you can see when we do the non-stress test. In the graph, if the fetal heart rate is increased with the movement, that is acceleration and that is a good. If the fetal heart rate is decreased with the movement, that is a deceleration and that is a bad, and we need to identify what causing the deceleration and treat accordingly. So if we talk about the result, there is two results you can see in the non-stress test. One is reactive, which is normal, negative, that's perfect. Next one is non-reactive, that is abnormal, and we need to do further testing to identify the cause. In the reactive, indicate the healthy fetus, and we need to see the acceleration of fetus, and it should be at least 15 beats per minute, which is the last at least the 15 seconds from the beginning of acceleration. So if you see in the graph, you can see when the fetal move, you can see the heart rate goes up at least for 15 beat per minute, and which is lasting for 15 seconds, and there should be 2 acceleration during the 20 minutes. If there is 2 acceleration or more within the 20 minute of the NST test, that is a perfect, that is a normal. If there is no acceleration or acceleration of less than 15 beat per minute or lasting less than 15 seconds in duration occurring during the 40 minutes of observation, that is abnormal, and we need to do further testing if result is non-reactive. Next test is group beta streptococcus. So this test we do around 36 weeks of gestation. We take a vaginal or rectal swab to detect the presence of group beta streptococcus, and then laboratory screening will determine the presence of GBS, and if there is a presence of GBS, then we need to give the treatment for that. Antibiotic treatment is given. Next test, we do the kick count, fetal movement counting. This is for the assessment of the fetal well-being, and it's beginning at the 28 week of gestation. The client sit quietly or lie on the side and count the fetal kick as instructed. And need to inform the client that it is necessary to feel at least 10 movement within the 2-hour period, or as instructed by the primary healthcare provider, because sometimes less movement is felt and if the baby is sleeping. Thank you for watching. Please subscribe to my channel and keep watching, keep supporting. Thank you.